The Fed15 podcast is presented by Serving Those Who Serve, a financial planning practice serving federal government employees and retirees all over the country. This podcast is for informational purposes only and is not intended to be taken as financial advice. All listeners should consult their personal advisors before taking any action. The opinions expressed by our hosts are their own and do not reflect the views, policies, or position of either Raymond James or Serving Those Who Serve. Securities are offered through Raymond James Financial Services, Inc., member FINRA SIPC. Investment advisory services are offered through Raymond James Financial Services Advisors, Inc. Serving Those Who Serve is not a registered broker-dealer and is independent of Raymond James Financial Services, Inc. Hi, everybody, and welcome back to this week's episode of the Fed15 podcast presented by Serving Those Who Serve. Each week, we'll discuss the latest news and info that feds need to know in 15 minutes or less. So whether you are a seasoned federal employee or whether you're just starting out in your career, Fed15 has got you covered. So grab your coffee, kick back, and we'll tell you what you need to know but might have missed over the past week in the federal employee space. We're your host. I am Katelyn Murray, and I am joined by Dan Sipe. And those of you who are joining us on YouTube may notice that we have a third person here with us today. We've got a new face. Dan, tell us all about today's guest.
Indeed, we do. Joining us today from Consumer Checkbook Guide to Federal Health Plans is Kevin Moss. Now, let me give you all a little bit of background here so you kind of appreciate who we got. So the checkbook was first published in 1976 in paper form, and the first guide to health plans came in 1979. So that's how long they've been helping you feds. Okay, the online version that we've all come to know and love debuted in 1996, and perhaps the momentous point was 1998 when Kevin Moss joined the team. Because subsequently in 2015, they won the Robert Wood Johnson Foundation's Plan Choice Challenge. This was a nationwide competition to produce the best online tool to help folks select the best health plan for themselves. So this begs the question. They won after Kevin joined. Coincidence? I say not. So welcome, Kevin.
Hi, Dan. Hey, Katelyn. Thanks for having me today.
If you haven't guessed,
glad to have you.
I need to say at the outset, I'm a fan. Okay, I read your articles. I attended your open season webinar last year. Great stuff. And when it comes to deciphering health plans for feds, you're the guy. And Katelyn, tell me if I'm getting this right in young person vernacular. So he's him, right? So Kevin is him. Is that it? Did I say that right?
He's him. He's the guy.
Yep.
I don't know, Dan. You're often way more up on the lingo than I am. Dan teaches me stuff all the time. Like, I'm still on drip, and I think we left that behind like several iterations ago.
Okay. So he's him. And today we're talking high deductible health plans and healthcare savings accounts. So Kevin, you've written great articles on this. Tell us why you think every Fed should at least consider this combo.
All right. Well, thanks, Dan. High deductible health plans. Yeah, as the name suggests, they do have high deductibles. I think it may be one of the worst marketing names for these because they pick out the one piece of this that you're probably not going to like, and they call all the plans high deductible health plans. And they don't tell you, maybe if you're just thinking about the plan name, about the health savings account piece. And that is really the killer part of these plans, is the fact that a high deductible health plan offered through FEHB is going to give you a health savings account. And beyond just having that account, what makes these plans so powerful in terms of offering lower costs to many federal employees is the fact that the plan itself is going to contribute a portion of the premium into the high deductible health plan. This happens as a monthly premium pass-through. You don't get the full amount at the beginning of the year when you enroll in one of these plans. It's given to you on a monthly basis. Depending upon your enrollment, if you're a self-only Fed, depending upon the plan, anywhere from $750 to $1,200 a year is going to go into this HSA without you having to do anything. And if you're a self plus one or self and family enrollee, it's double. So between $1,500 to $2,400. Now, with those HSA funds, you can use them for any qualified out-of-pocket healthcare expense that you face during the year. However, you do have a choice with these HSAs to choose to invest those funds. And it's the investment potential, and it's also the potential for you to put voluntary contributions as well into this HSA. You can choose to invest these funds. HSAs are triple tax advantage. Any voluntary contributions that you put into the HSA, they go in tax-free. They grow tax-free, so you can choose to invest, and many of the same investment vehicles that you would see in retirement accounts will be available in your HSA. And if you withdraw these funds for qualified healthcare expenses, they always exit the HSA tax-free. And some good news that we just found out from the IRS last month is that the contribution limits are going to be rising next year for 2025. So self-only enrollees can contribute up to $4,300 next year. That's $150 more than last year. And if you're a self plus one or self and family enrollee, you can go up to $8,550. That's a $250 increase. So we really see high deductible health plans with HSAs a great way to save you money today, but importantly, an important way to save money in the future. You know, most of us are going to have higher healthcare costs as we age, and you can right now start preparing for those higher healthcare costs by enrolling in a high deductible health plan. You know, whatever additional money you can put aside into the health savings account, you can choose to invest that. And if you don't mind paying out of pocket a little bit for your healthcare costs, and let's be honest, your out of pocket costs before you meet the deductible are going to be higher in a high deductible health plan. You know, many PPO plans, you'll only have to pay like $20 to go see a doctor. But before you meet the deductible in a high deductible health plan, you may have to pay $150. You should know that. You have the health savings account there to draw from if you need help with that out-of-pocket expense. But if your situation allows for, you know, you being able to afford to pay those $150 copays when you get sick, and you can keep that HSA preserved, invested, growing over time. Hopefully we all see stock market returns like we've seen, you know, this year. This can really grow, can compound over time. And, you know, we know many federal employees that have $40,000, $50,000, $75,000 in health savings accounts because they've been around for a while. They've been able to make those maximum contributions. They haven't drawn from it. And this is, you know, they've now built up this large amount of money to help pay for expenses when they retire. So let me stop there and just see what other questions we have that may come out of that.
Yeah, thanks for that overview, Kevin. Really, really good kind of breakdown and highlighting of the voluntary contributions, as well as the kind of quote unquote match that you're getting, money that you're not even having to put in. And I am a self-stated, you know, routine listeners of the podcast know I'm a self-stated HSA evangelist. I love HSAs. I have an HSA. For most of the time that I was funding my HSA, I was a self-only funder. And you would be surprised how quickly those contributions stack up over time, especially if you're investing in the HSA and kind of planning around covering maybe those slightly higher out-of-pocket costs for your healthcare and not tapping the HSA. I think it's one of those, HSAs are often one of those things where if you know what it is going in and you know that you're going to maybe have some higher costs when you go to the doctor, when you go to urgent care, things like that, and you can plan to set that cash aside, as opposed to somebody signing up for an HSA and maybe not realizing that you are going to have a slightly higher deductible as a result. It really kind of makes all the difference, I think, that HSA strategy. So for those of you who are visual learners like myself, and you kind of need to see it written out, we do have an article kind of summarizing our conversation on HSAs today, as well as with those new contribution limit numbers. If you were somebody who's already enrolled in an HSA, definitely want to be aware for those limits going up next year. You may want to adjust your voluntary contribution there to make sure you're still maxing out if that is your goal. So another question for you, Kevin, with these high deductible health plans, I know we talked about the potential increased cost when you go to the doctor, when you go to urgent care, and making sure that we plan for that. But isn't it true that with a high deductible health plan, your premium might also come down a bit? Maybe there's a little bit of cushion there.
Yeah, it's not true 100% of the time. It, of course, depends on what your current plan is. But what we know is that many federal employees are in a Blue Cross Blue Shield plan. In fact, almost 2/3 of all federal employees and retirees are in one of the Blue Cross Blue Shield plans. Blue Cross Standard in particular is the highest premium of any national PPO plan. And so, yes, there is a potential that you're going to be saving in a lot of for sure expense by enrolling in a high deductible health plan by paying a lower premium. And it may be tempting for you to just pocket that as like a little bit of a little pay bump when you switch to a high deductible health plan. But it's actually one of the strategies that I talk about all the time as a way to sort of maximize the potential of the HSA is even if you can't contribute more than just that premium difference, you've already been budgeting paying that higher premium. Just take that difference to start with and put that into the HSA as a voluntary contribution. You can then draw upon that if you need to for out-of-pocket healthcare costs, and you will be able to preserve what that plan is putting in for you. So I love that strategy. I think the other strategy I love for maximizing your HSA is one of the IRS rules with HSA is that you can't also at the same time have the flexible spending account. So if you're an active employee, you can't, it's kind of like double dipping on tax savings. You can't have the flexible spending account and the health savings account, but you are able to take out what's called a limited expense healthcare FSA. This is only for dental and vision. But we also highly recommend doing that because dental and vision expenses are somewhat predictable. Yes, there can be some unexpected things that happen on dental and vision, but most of us at least know in terms of our routine maintenance, how much out-of-pocket costs we're going to face in any given year on dental and vision. Take out the limited expense healthcare FSA. Use that for dental and vision. Don't use your HSA for those costs. That's another way to keep your HSA invested. Those plan contributions preserved. Hopefully it's growing over time. We're compounding those investment returns, and it's going to lead to this larger HSA balance when it comes to retire.
That is an awesome tip, Kevin. I don't know about you, Dan, but I wasn't aware of that strategy. So that's very cool to do the limited, you said it's a limited FSA.
Yeah, it's a limited, limited expense healthcare FSA. It's the same, organization that runs the regular FSA. So it's FSA Feds. That's where to go. And you can sign up for the limited expense healthcare FSA. It has the same open season as the FEHB open season. So if you don't have that now, and by the way, even if you decide that a high deductible health plan is not the right plan for you, if you are not retired and you don't have a flexible spending account, get the flexible spending account. I mean, it's something like only 20% of all active federal employees have an FSA. It should be 100%. It's a guaranteed way to save 30% on all qualified healthcare expenses, and at least do that piece. There's some tax advantaged programs available to federal employees that are only available when you're an active federal employee. Once you retire and you have Medicare, you can no longer do the FSA. You no longer get an HSA when you have Medicare, you retired from a high deductible health plan. Instead, you get what's called an HRA or a health reimbursement account. Works very different than the HSA.
Gotcha. Yeah. Great tip. That's why you're the best, Kevin.
Absolutely.
That's why we have you on the podcast. Well, nuggets like that.
Folks, one of the things that I'll just throw in here, because Katelyn, this is something that when we do financial planning, we talk about with insurance, you want to have the policy protect the risk you cannot easily pay and absorb the part that you can. So, we'll still encounter people that come to us new that are, in their 40s, making great money, and they've still got $100 deductible on their auto insurance. And accepting the fact that there would never be a day that you wanted to have to spend $500 to get your car fixed. You wouldn't have to take out a loan to do it. Yeah. But you're not going to have to get it fixed every year. And it's kind of the same strategy here. So great tips, great strategy there, Kevin.
Absolutely.
Yeah, and there's a couple of final things that we should talk about with the high deductible of HSA. One of the great pieces of the FEHB program is you're only committing to 1 year. You're not committing to the rest of your life. And you could, if you haven't, been with a high deductible health plan, you could try it for 1 year. And a very cool part with the HSA is that's fully portable because you, the federal employee or the account owner, you own that account. You never lose what's in that HSA. So even if you took out the high deductible health plan and you got the HSA and for whatever reason it didn't work out for you, your HSA is yours. It's yours for you to use, even if you switch back to the PPO plan that you had before. And the other thing that I want to talk about is the fact that the HSA allows for non-medical distributions. It's something that you have to be very careful with before the age of 65, because you not only have to pay your regular tax obligations on withdrawals for a non-medical distribution, but there is also a 20% penalty for early withdrawal out of HSA for non-medical distributions. That, however, goes away once you turn 65, the penalty part. So then if you make a non-medical distribution after 65, you're only paying regular taxes. And so in many ways, this is like a traditional, retirement account where you are only paying taxes on withdrawals. It gives you flexibility with this money. You could choose to use it on Medicare Part B premiums. You could choose to use it on any out-of-pocket healthcare costs that you face when you retire, or you could choose to take your family to Hawaii, but realize that you'll have to pay taxes if you take your family to Hawaii on taking money out for that purpose.
Yeah. And I think that's particularly important when we get into looking at, and there was an article on the blog a couple of weeks ago on the best and worst types of accounts to inherit. And although, again, self-stated HSA evangelist, I love them. You use them right. You never end up paying taxes on that money, but they do not transition well in the event of the death of the original account owner. I will put a caveat in there. The first account owner, if you are married, your spouse can inherit the HSA and use it just like it was their HSA. So if you're married and your spouse is primary beneficiary, if something happens to you, there's not a big issue with that transition. However, if your children or anyone else who you are not married to is listed as your beneficiary on that HSA, what happens in the event of your demise is the non-spouse beneficiary gets that HSA cashed out immediately, and 100% of it is taxable at their income tax rate in the year of distribution. There is no way to change it and there is no way around it. So this is why we tell retirees who are carrying an HSA into retirement to kind of prioritize spending down that HSA. The good news is for most people, there's no shortage of medical expenses as we get older, as Kevin mentioned earlier. But, it is wise to be aware of that rule, that 20% penalty peeling off at age 65. Because if you're getting into your upper 60s and you still have a considerable HSA balance, there is some value to kind of leaning into those funds to make sure that it's not a tax time bomb for your beneficiaries. So just want to kind of add that caveat there.
Gotcha. So, Katelyn, I want to make sure I'm clear on this. I should rejoice that I'm seeing more doctors now that I'm older. No, this is a real paradigm shift for me. I'm going to wake up with a smile on my face now.
Yeah, embrace it.
Because I might not have been appreciating that blessing. I think that's all the time we have today, folks. Kevin, amazing. You are as advertised. He did all that without notes, folks. I mean, that's incredible. So, hey, will you come back and talk to us?
Yeah, would love to. And, our guide is out there. It's at guidetohealthplans.org. And we set up a special discount code for all your listeners and readers of your blog. It's you can save 20% by putting STWServe into the promo code. And also, we have dozens of agencies that are providing free access to our Guide to Health Plan. So if you go to guidetohealthplans.org, you can see that list of agencies that provide free access or use STWServe to save 20%.
Absolutely.
Nice. Absolutely. Definitely check it out.
We will be back. We'll be back next week to bring you the latest updates you need to make informed decisions as a Fed for your career and financial well-being.
Absolutely. And to make sure that you don't miss next week's episode or any episodes, go ahead and subscribe to the podcast on our YouTube channel as well as Spotify. And do remember to share it with your friends and colleagues. If you, special request, if you know somebody who is a young Fed who is maybe just starting out in their career, maybe they don't have kids, probably their healthcare expenses are kind of low. go ahead and share this episode with them. They should know about HSAs. And it is the number one thing that I find, these days, most of the time, young feds who are coming in, they're aware of the TSP match. They make sure that they're contributing enough to get that free money, and we love to see it. Most of them have no idea what an HSA is. So forward this episode to them. If you have somebody on your team, go ahead and, loop them in.
Absolutely. And for more information on the topics we cover today and more, check out our blog at blog.stwserve.com. Subscribe to our newsletter, The Weekly Serving, and you'll get the latest stuff delivered straight to your inbox every single week.
And for those who want to dive even deeper into learning about your federal benefits and financial planning for feds, we encourage you to join us for one of our complimentary webinars. We've got TSP planning coming up on June 20th from 1 p.m. to 4 p.m. That's always a good one to start with. Nice entry level, but we delve into the depths pretty quickly there with TSP. And then if you are curious about learning more about high deductible health plans and the HSA strategy that we talked about in today's podcast, you can join us for our FEHB webinar on July 31st. I know it's kind of a ways out, but mark your calendars. It's from 10:30 a.m. to 2:30 p.m. My main man, Dan Sipes, going to be hosting it along with Ed Zerndorfer, and they're going to be kind of diving into all of the different FEHB eccentricities and flavors and options, and it's going to be a good time.
Yep.
So definitely mark your calendar for that so you can be prepared going into open season this fall. Of course, if you prefer a one-on-one approach, you can always reach out to our team at askstws@stwserve.com. You can reach out to us for a financial planning consultation, or help with TSP, help with your investment portfolio. We're always happy to help with that.
Absolutely. So, Kevin, thank you for joining us. To all of our listeners, thanks for listening to Fed15. I'm Dan Sipe.
And I'm Katelyn Murray.
And he's Kevin. We will see you next week.
Just Kevin, like Prince.
Yes,
I like it.
Absolutely. He's him.
See y'all.